We continue with general adult tests. This time we talk about blood oxygenation. Pulse oximetry is a painless method of checking how much oxygen is in your blood. The oxygen is attached to the chemical hemoglobin inside red blood cells, which circulate in the bloodstream. The test is performed during a routine examination or sometimes on arrival at an emergency department. A plastic device is clipped onto the end of your finger. It shines red and infrared light into your small blood vessels and measures how the light is absorbed, which relates to the oxygen saturation level of the hemoglobin. The result is given as a percentage. The normal range for an adult or child is 95 to 100%. At 94% or below, you could have an underlying breathing problem such as asthma, or you could simply be very cold and the tracing is not picking up accurately. Vital signs. The red light used by oximetry measurement is visible in this portable pulse oximeter, which can be used at your doctor's office or in the home. In the hospital, pulse oximeters are attached to larger vital signs machines that also measure heart rate and blood pressure. Most people do not need to monitor their blood oxygenation with a pulse oximeter at home. However, some fitness tracker devices and smartwatches shine light through the skin to measure oxygen saturation. Some smartphone apps even use light from your phone's camera flash. However, at present, these are not accurate enough to be trusted as medical devices. Thank you for your attention.
Pathology. Phlegm or phlegm is the origin of many diseases. Many diseases have phlegm. Phlegm is the already wide and it usually gives syndrome indicates a condition where phlegm is the cause of most pathological changes. Thus, just because there is phlegm, it doesn't mean that there is a phlegm syndrome. Phlegm assumes many different forms, which contributes to causing very many different problems. For example, wind phlegm, cold phlegm, and phlegm heat. Phlegm easily damages the stomach and spleen. Phlegm obstructs the middle burner and very easily leads to deficiency of the stomach and spleen. In particular, the stomach is affected by phlegm, and prescriptions that resolve phlegm often have herbs that harmonize the stomach. On the tongue, chronic phlegm often manifests with a stomach crack with a sticky, dry coating inside it. Phlegm easily mixes with other pathogenic factors. Phlegm often mixes with wind, cold, heat, and dampness. Chinese doctors give various guidelines to follow in complicated chemical situations that often harbor phlegm. The following are some of them. In a strange disease treat phlegm, this refers to complicated clinical patterns with symptoms and signs that do not seem to fit into any pattern. For example, a strongly built man wakes up frequently during the night, dreams a lot, has a voracious appetite, and the tongue is swollen. This condition is most probably due to phlegm. Another example could be that of an elderly woman with palpitations, constipation, thirst, insomnia, and bitter taste. These manifestations could be due to phlegm heat. In complicated syndrome, treat phlegm. In acute, serious disease, treat phlegm. Example, with stroke, heart infarction, cancer. If you can see phlegm, treat phlegm. Thank you for your attention.
Good day. Today we're going to talk about the Foot Yang Ming stomach meridian, stomach 19, pull wrong or not at ease. As seen on the illustration of stomach 19, pull wrong, on the upper abdomen, 2 chon lateral to the anterior median line, 6 chun above the umbilicus. Stomach 19, bu wrong, not at ease, not contained. The first point on the stomach meridian after it leaves the thorax and is no longer contained by the ribs. The meridian now runs into the area of the abdomen. If one overeats and feels full up to here, one cannot ingest or, or any more food or it will rebel. This point is used when the stomach cannot digest, process, and contain food and drink, when there is vomiting, lack of appetite, and inability to digest. After excess or to reach a diet at the level of the body, mind, and spirit, when we overdo activity, overeat, or overthink to the extent that we are unable to process and digest physically and mentally, this point is beneficial. When stomach chi fails to appropriately regulate and sustain us, all the processes it oversees can be knocked off their usual cycle. The processing of food, thought, reproduction, and menstruation. When we are out of sync with ourselves, we are not at ease, and preoccupation, tension, circular thinking, and stagnation of thought and activity ensue. Not at ease can assist the official of rotting and ripening to move through inertia and regain the rhythm and correct patterning it needs for the processes of the body, mind, and spirit to be nourishing and effective, so we feel able to digest information and events as well as food. Strategically, the official of rotting and ripening occupies a very important place in the middle jiao. Many meridian pathway ascend or descend through the middle jiao, and stomach chi plays an important role in ensuring both smooth rhythmic flow in the area and that the chi descends appropriately. Effectiveness can be enhanced in combination with spleen 8, or with stomach 24 and spleen 16 when there is rebellious chi or stagnation of the stomach. Indications: mental and physical discomfort after excess, mental churning, and overeating. Indicated when the patient is not at ease with themselves, it is tied up with a worry or with obsessional thinking patterns. This point calms and eases an anxious and insecure patient. It can also be useful when a person is not digesting or processing their food and drink properly, perhaps as a result of severe emotional stress. It has a bearing on the rhythms of life. Thank you for your attention.
Cold stagnation in liver channel. This is due to a cold pathogen invading and congealing in the liver channel and manifests as a cold pain along the liver channel. It is also called liver cold pattern. Key symptoms: cold pain in the lower abdomen and pudendum, vertex cold headache, a deep and tight pulse or a wiry and tight pulse. Clinical manifestations: cold pain in the lower abdomen, which refers to the scrotum and testes, alleviated by warmth, aggravated by cold, distension, and bearing down sensation in the pudendal area, or straining of the testes, or contraction of the external genitalia or scrotum, a vertex headache, cold body and limbs, a pale tongue with a wet and white coating, and a deep and tight pulse, or wiry and tight pulse. Analysis of cold stagnation in the liver channel. As cold congeals in the liver channel that leads to chi stagnation, chi and blood do not move smoothly, and contraction of the channels result. So there will be cold pain in the lower abdomen, straining of the testes, or contraction of the scrotum, and vertex cold headache. Cold pathogen damaging the yang chi will cause failure of the yang qi to spread, leading to cold body and limbs. This will also lead to coagulation of qi and blood, which is alleviated by warmth, aggravated by cold. And this will result in a pale tongue with wet and white coating, a deep and tight pulse, or wiry and tight pulse, which are signs of an excess cold pattern. To summarize, stagnation of cold in the liver channel etiology is invasion of exterior cold. Underlying accompanying pathology, invasion of the liver channel by cold. Signs and symptoms, fullness and distension of the hypogastrium with pain, which refers downwards to the scrotum and testes, and upwards to the hypochondrium. Alleviation of pain by warmth, straining of the testes or contraction of the scrotum, bright white complexion, green, blue, or purple lips, vertex headache, a feeling of cold, cold hands and feet, vomiting of clear watery fluid, copious clear urine, loose stools. In women, there can be shrinking of the vagina. Pulse, deep, wiry flow. Tongue, pale and wet with a glossy white coating. Treatment principle, warm the liver and dissipate cold, rectify qi and stop pain. Acupuncture treatment. REN 4, to scatter cold in the genitals. REN 6, to warm the lower burner. Spleen 6, warms the liver, nourishes blood. REN 3, scatters cold from the lower burner. Liver 5 scatters cold from the liver channel. And liver 1 clears the liver channel. Liver 3 courses the liver qi. We needle with drainage. Moxa can be used in large amounts if there are significant cold signs. Relevant advice. If the stagnation of cold in the liver channel is a chronic or recurring pattern, the person must make sure that they wear adequate and appropriate clothing and footwear. They should avoid exposure to the cold and damp. Thank you for your attention.
Let's now go to inquiring. Let's discuss common symptoms in internal medicine, part 3. Common symptoms in internal medicine. Hematemesis, an abrupt vomiting of bright red blood accompanied by fever, thirst, gastric pain, a red tongue with thick yellow coating, and a slippery and rapid pulse is mostly due to burning heat in the stomach, injuring the stomach meridian. Vomiting of bright red blood accompanied by chest tightness, distension and pain in the flank and abdomen, agitation and irritability, and a taut and rapid pulse is mostly due to unregulated passions of liver fire attacking the stomach. Vomiting of light red blood accompanied by dull gastric pain that is alleviated by pressure, palpitation of the heart, anorexia, with loose feces, a pale complexion, and a thread-like and feeble pulse is due to insufficiency of both the heart and the spleen. The mechanism is erratic movement of the blood due to the inability of the deficient qi to control blood movement. Vomiting of dark purple blood with clots accompanied by sharp gastric pain, worsened by pressure and purpuric spots on the tongue is due to blood stasis. The mechanism is blood extravasating and flowing through abnormal pathways because of blockage of the normal pathways by static blood. Hematemesis is the principal clinical symptom of bleeding in the upper digestive tract. It may also be seen in peptic ulcers, chronic enteritis, stomach cancer, and cirrhosis of the liver. Hematochezia, this is bleeding from the anus or the defecation of blood along with mixed with feces. Hematochezia accompanied by thirst and preference for cold drinks, halitosis and bitter taste, constipation, burning sensation in the anus, a red tongue with yellow coating, and a rapid and forceful pulse is due to exogenous heat in the stomach and intestines, damaging the blood vessels. Sometimes there are first blood then feces. The blood is fresh, but the defecation is difficult. This is accompanied by a red tongue with a yellow greasy coating and a slippery and rapid pulse. It is due to dampness and heat together baking blood and damaging the large intestine meridians. Sometimes there are first feces then blood, and then there is blood alone, and the blood is dark purple or the feces resemble tar. If this is accompanied by a lusterless complexion, cold body and limbs, a pale tongue, and a thread-like and feeble pulse, is due to the deficiency cold of the spleen and the stomach, and failure of qi to control blood. If the blood is fresh and bright red and the anus severely painful, it is hemorrhoids. Hematochezia is the principal symptom of bleeding in the lower digestive tract. It may be seen in all types of enteritis, intestinal cancer, intestinal tuberculosis, certain nutritional deficiencies, and various illnesses of the anus. For hematuria, in the blazing of heart fire, the blood in the urine is fresh red, the urethra is painful as though scalded and abraded, the heart palpitates, and the mind is restless. Dampness heat in the bladder produces hematuria, accompanied by frequency, urgency, and pain on urination. Insufficiency of both the spleen and the kidney leads to light red hematuria that is recurrent without resolution, and that is accompanied by anorexia, abdominal distension, and lumbar and knee aches and weakness. Hematuria may also be seen in tuberculosis of the urinary tract as well as stones, tumors, or injury anywhere in the urinary tract. A variety of blood disorders also can cause hematuria. For impotence accompanied by spermatoria, lumbar and knee aches and weakness, cold aversion and cold limbs, and a deep and thread-like pulse is due to deficiency of kidney yang. Impotence accompanied by scrotal maceration, itch or pain, decreased and red urine, a yellow and a greasy tongue coating, and a slippery and rapid pulse is due to dampness heat descending into the genitals. Impotence accompanied by agitation, irascibility, emotional depression, and a thought pulse is due to gelling of liver qi. Impotence accompanied by palpitation of the heart, shortness of breath, spontaneous sweating, fatigue, and a reduced appetite is due to insufficiency of both the heart and the spleen. And lastly, for spermatoria, is the spontaneous emission of semen without sexual excitation. Spermatoria accompanied by palpitation of the heart, restlessness, a red tongue, and a rapid pulse is due to blazing heart fire. Spermatoria accompanied by erection without sexual stimulation, yellow urine, and a thought pulse is due to passion-induced fire. Spermatoria accompanied by palpitation of the heart, insomnia, and the lumbar and knee aches, and weakness is mostly due to disharmony between the heart and the kidney. Spermatoria accompanied by cold aversion, cold limbs, lying in the fetal position, a pale tongue, and a deep and feeble pulse is mostly due to deficiency and decline of kidney yang. And for spermatoria accompanied by a recurrent fever, night sweat, a red tongue with little coating, and a thread-like but rapid pulse is due to depletion of kidney yin. For spermatoria that may also be seen in mental deterioration, inflammation of the prostate gland, and seminal vesicles. Thank you for your attention.
Let us now discuss the components of comprehensive review of systems. General constitutional. Ask about weight loss or gain, changes in appetite, general state of health, sense of well-being, strength, energy level, ability to conduct usual activities, and exercise tolerance, night sweats, and fever. For the skin, we ask about skin changes, including rashes, itching, pigmentation, moisture or dryness, texture, changes in color, size, or shape of moles, changes in hair, growth or loss, and changes of the nails, for example, clubbing, spooning, or ridges. For the eyes, we inquire about injury, double vision, visual acuity for near and far, sudden loss of vision, tearing, unilateral or bilateral, blind spots, pain, blurring of vision, ability to see at night, especially if the patient operates an automobile, photophobia, halos around lights, and headache suggestive of narrow angle glaucoma. Discharge, seeing spots may indicate floaters. For the ears, we question about pain, discharge, injury, including barotrauma associated with air travel, diving, hearing acuity, tinnitus, vertigo, balance, the inner ear function, frequency and severity of ear infections include treatment, care of ears, including wax or cerumen removal if performed. For the nose, we ask about nosebleeds, including frequency, colds, obstruction, discharge, including color and quantity, changes in sense of smell, polyps, sneezing, and postnasal drainage. Mouth, throat. Inquire about dental difficulties, lesions, gingival hyperplasia and bleeding, use of dentures, adequacy of saliva flow, hoarseness, difficulty articulating words, dysarthria, frequency and severity of sore throats, including treatment, and changes in the appearance of the tongue or sense of taste. Ask about nerve stiffness, pain, tenderness, masses in thyroid or other areas, and lymphadenopathy, pain or swelling of the lymph nodes. Cardiovascular. Question about chest pain, substernal distress, palpitations, syncope, dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea, edema, cyanosis, hypertension, heart murmurs, varicosities, phlebitis, and claudication, hemoptysis, and coldness of extremities. Note severity and conditions under which this occurs. Respiratory, we ask about pain, including location, quality, and relation to respiration, shortness of breath, dyspnea, wheezing, stridor, cough, noting time of day, and, if productive, amount in tablespoons or cups per day and color of sputum. Hemoptysis, respiratory infections, tuberculosis or exposure to tuberculosis, and fever or night sweats. Note date of last chest x-ray if applicable. Gastrointestinal, inquire about appetite, dysphagia, indigestion, food idiosyncrasy, abdominal pain, heartburn, eructation, nausea, vomiting, hematemesis, jaundice, polyps, constipation, diarrhea, abnormal stools, for example, clay-colored, tarry, bloody, greasy, foul-smelling, flatulence, hemorrhoids, and recent changes in bowel habits. Thank you for listening.
Let's now go to acupuncture for emergencies. Let's discuss stroke, key points of analysis, and differential diagnosis. For key points of analysis and differential diagnosis, a stroke may be diagnosed if there are two or more of the following group findings. First, principal symptoms: mental confusion, loss of consciousness or coma, hemiplegia with dry mouth and tongue, dysphagia or aphasia, a numbness in the affected parts. Second, abrupt onset, often associated with sudden changes in weather, excessive physical fatigue or exhaustion, or overstimulation of passions or other emotional stress. Third, preceding symptoms of dizziness, headache, numbness, or weakness in the limbs. And fourth, the patient's age is over 40. Deficiency versus strength. A stroke is a condition wherein the root is deficiency and the appearance is strength of symptoms. The acute phase is mainly a condition of strong symptoms. In a patient with chronic dizziness and headache, sudden appearance of hemiplegia, especially if accompanied by loss of consciousness, tetany, or convulsion, the condition is due to the stirring of endogenous wind. If the prominent symptoms are expectoration, of much sputum, respiration with gurgling in the throat, a disturbed mental state, and a white and greasy tongue coating. It is due to large accumulation of turbid phlegm. If the prominent symptoms are a dry mouth with bitter taste, restless agitation, scant dark urine, constipation, and feverish in the neck and back, is due to exogenous heat. If the limbs are flaccid and the tongue is cyanotic, it is due to deficiency of yang qi and much phases of blood. The convalescent phase is mainly a condition of deficiency. If paralysis of the limbs is accompanied by edema of the hands and feet, shortness of breath, spontaneous sweating, and copious salivation, the condition is mostly due to qi deficiency. If there is cold aversion and limbs are cold, it is mostly due to yang deficiency. If the prominent symptoms are restless, with insomnia, dry mouth, hotness in the palms and soles, a red tongue with scant coating, it is due to yin deficiency with internal heat. Meridian versus viscera. The stroke may be classified as that primarily involving the meridians and that primarily involving the viscera. In stroke involving the meridians only, the mental state is unaffected and the prominent symptoms are hemiplegia or numbness, stiff tongue with dysphagia or aphasia, and a wry mouth and tongue. The pathogenic evil is relatively shallow and the condition relatively mild. In stroke involving the visceral organs, there is mental confusion or loss of consciousness. The pathogenic evil is relatively deeper and the condition relatively more serious. Stroke involving the visceral organs may be further classified as the blockage type and frustration type. The blockage type of stroke manifests disturbances of the mental state, trismus, and spasticity of the limbs. It is due to pathogenic evil qi blocking the upper orifices and is a condition of symptom, a pathogen strength. If in addition there are facial flushing, body feverishness, hoarse respiration, halitosis, restlessness, a yellow and greasy tongue coating, and a slippery and rapid pulse, the blockage is caused by phlegm heat. This is stroke due to yang blockage. If instead the additional symptoms are pallid lips and complexion, calm resting, copious saliva and sputum, cold limbs, a white and greasy tongue coating, and a deep and slippery or even pulse. The blockage is caused by dampness phlegm. This is due to yin blockage. In contrast to the blockage type, the frustration type of stroke manifests coma, closed eyes and open mouth, flaccidity of all limbs with open and relaxed hands, cold limbs, incontinence of urine and feces, and a shallow and weak respiration. Frustration stroke is used by the escape of the outside of genuine yang of the Zhang viscera. And lastly, for course and prognosis, progression of the meridian type out to the viscera type reflects waning of genuine qi and waxing of evil qi. It indicates worsening of the condition and a poor prognosis. This progression can be recognized from the development of coma and spasticity and impairment of pupillary reaction to light. Conversely, progression from the visceral type to the meridian type with improvement in the mental state indicates improvement and a better prognosis. Thank you for your attention.
Erectile dysfunction, heart and kidneys not communicating, heart and kidney yin deficiency, clinical manifestations, impotence in the elderly, 5-palm heat, dizziness, tinnitus, night sweat, palpitations, lower back, depression, insomnia, poor memory. Tongue is without coating, also red if there is empty heat. Pulse is floating empty. Treatment principle: nourish heart and kidney yin, calm the mind. Points: heart 7, Ren 15, small intestine 3, bladder 62, bladder 23, ren 4, kidney 3, spleen 6. Explanation in acupuncture. Heart 7 and ren 15 nourish heart yin and calm the mind. Small intestine 3 with bladder 62 open and regulate the governing vessel. Bladder 23 strengthens the kidney. Ren 4, kidney 3, and spleen 6 nourishes kidney yin. Thank you for your attention.